Hi, I'm Dr. Glenn Goloszewski from Mountain Valley Hospice and Palliative Care. Today we're going to discuss a little bit about one of the really wonderful parts of the hospice Medicare benefit, hospice care in an inpatient facility. Mountain Valley Hospice is very blessed to be able to provide hospice care to patients and their families in two facilities, the Woltz Hospice Home in Dobson, North Carolina, and the Secu Home in Yadkinville, North Carolina. Both facilities are Medicare certified for the short-term care of patients enrolled in hospice. The Woltz Hospice Home and the Secu Home were specially designed and built to meet the special needs of hospice patients and their families. And the staff has been specially trained to serve the unique needs of our patients and their loved ones at the end of life. In the IPUs, we strive to maintain a quiet, peaceful environment where patients can receive state-of-the-art, evidence-based, expert end-of-life care while being treated with respect and dignity. Although COVID has required us to introduce some limitations on visitors, the facilities were designed to allow patients' loved ones to comfortably visit for extended periods of time. Inpatient care is generally required for two situations. The most common is when a patient is experiencing uncontrolled symptoms or requires frequent medication adjustments or other interventions that cannot be feasibly managed in the current setting. The second indication for inpatient care is a 5-day respite stay to allow the caregivers a break. Your hospice inpatient team is made up of professionals from a variety of disciplines that work together to provide assistance with all aspects of your care. So our facilities are required to have a registered nurse in the house 24/7. Physicians or nurse practitioners are going to round on all patients in the general inpatient level of care every day. Hospice aides provide personal care to all of our patients. Social workers help meet the social and emotional needs of our patients and their families and assist families with insurance questions and long-term placement options. Chaplains are trained to administer to the spiritual needs of all religions and belief systems, and we have a fully staffed kitchen staff, cleaning staff, and maintenance staff, all of which contribute mightily to the care of our patients. Our kitchen staff in particular is wonderful at making sure that they supply good tasting, appealing, warm food for people that really aren't eating a lot at this stage in their life. And the kitchen staff goes shopping every day. If a patient has a hankering for something in particular, they'll go out and do what they can to make sure that patient gets what they want, even if they only take a bite or two. If they enjoy that bite or two, that's exactly what we're looking for. What kind of services are available in the inpatient facility? We can administer a number of medications, including injectable medications, antibiotics, and even continuous infusions of medications. Medications can be adjusted more frequently in the IPU because they can be given by injections under the close supervision of medical staff in a controlled setting. So what this means is that bothersome symptoms can be brought under control faster than we could have possibly achieved in a home or other setting. Artificial nutrition can be provided if the patient has a feeding tube, and in appropriate patients, intravenous fluids are sometimes offered. As we approach the end of life, our bodies are not able to utilize extra fluids, and these may accumulate in our lungs or abdomen or extremities, leading to some bothersome symptoms like shortness of breath. So for this reason, we try to never promise that a patient is going to receive IV fluids until they've been evaluated by a doctor or nurse practitioner, and then we've had time for an honest conversation about the risks versus benefit of fluids at this particular moment in life. Sometimes wound care become too complicated or time-consuming or require multiple medical staff to the point where it just isn't feasibly possible to do it in the current setting. In the IPU, we can dedicate the time and staff to develop the most effective wound care plan possible that we can then transition to provide in the home or previous setting. Palliative sedation is available in the IPU in cases where symptoms are severely bothersome and other interventions have proven inadequate. In these situations, patients are electing to try higher doses of medications, understanding that significant sedation may be needed to bring the symptom control that they desire. Many times at home, hospice staff will identify a patient or a situation that could benefit from an inpatient stay, but the patient or family may have some reservations about that. They may have heard that the inpatient facility is a place where people go to die, and they're not ready to die yet. They may be concerned that their loved one will be overly sedated, or family members may feel that allowing their loved ones to go to the hospice home in some way represents a failure on their part. So these are real concerns. Many people do in fact die in our inpatient facilities, but many also return to their previous living facilities. Our IPUs are only available to hospice patients who have terminal conditions and a life expectancy of less than 6 months. Most folks are transferred to our hospice homes because of a decline in their condition, so their life expectancy at that point is probably quite a bit less than 6 months. But if your goal is to go back home again, then we're going to make that our goal as well. Our providers will evaluate you and your loved one and make sure you have an honest conversation about you and your condition, your goals of care, and if you want, we can provide you with an estimate of life expectancy. You're going to have some difficult decisions to make. We want to make sure that you have an understanding of your condition so you can make the most informed decision possible. Many of the medications we use at the end of life have a sedating side effect because many of the symptoms we see at the end of life are severe, distressing, and require aggressive management. But rest assured, it is never our intention to do anything that would end or even shorten your life. The goal of our medications and other interventions is to bring severe and bothersome symptoms under better control. It's a continuous source of amazement to me how far some family members have gone and for how long in their dedication to care for their loved ones. We will commonly see spouses in their 80s caring for an agitated spouse by themselves out of respect to their marital vows. It is humbling to think about a patient that 3 staff members are struggling to care for in an inpatient setting, but they've been cared for by their 80-pound spouse at home by herself for months. You are anything but a failure. Your dedication is an absolute inspiration to those of us who care for people for a living. But the reality is that in many patients, especially at the end of life, there is the requirement for more than what one person can possibly give. We are never going to seek to replace you as a caregiver. We're here to help you in your caregiving role, but sometimes the best place for your loved one is in the inpatient facility. Medicare has a dictum for healthcare workers that we are supposed to provide the right care to the right patient at the right time in the right setting. And sometimes the right setting is the inpatient facility. Just like when the airplane attendant instructs the parents to put on their own oxygen mask before placing their mask on a child, a caregiver has to first care for themselves in order to be an effective caregiver. Having your loved one in an inpatient facility allows you time to focus on being a spouse or a daughter while somebody else is being the nurse or providing personal care. Your loved one is going to have many hospice caregivers, but they only have one spouse or son or partner. What you have to give can be provided by no one else. So often we see people who have been agitated or plagued by pain or difficulty breathing simply just relax by passing through the front doors. You can just literally see the tension melt away from their face and their posture. They seem to just know intuitively that this is a place where they're going to be taken care of, treated with respect and dignity, and they can stop worrying about being a burden to their family or their caregiver. And these are wonderful comforts at the end of life.